Robotic surgery in children is really important because it brings the most precise movements and minimally invasive surgery that meets the needs of the delicate body of a growing child. Stanford Children's Health is the first children's hospital to be onboarding the newest version of the Vinci surgical robot, the Vinci 5.
We have a wonderful reputation of being able to take great care of our kids and their families. This is another tool in our tool belt to do even better. We are an academic and research institution, and so our faculty, our professors, our surgeons will be able to do all kinds of new and great things with the robot.
When we have the level of precision we have with the robot, instead of cutting through things and then fixing them, we can adjust the way that we go around something. And so there's a lot of open surgeries where we used to know that we would need to cut through this vein, we would need to cut through this artery, or we would need to pull it to the side and there was a risk of bleeding. And at this point, we can actually work entirely around those structures, leave them entirely intact. And the visualization on the robot, it's really amazing. The ability to see things in 3D at this level, it almost feels like you yourself are inside the patient doing the surgery, rather than you're standing from the outside peering in through this little hole down a well trying to do the surgery precisely.
As you can imagine, with traditional open surgery, you're operating through these tiny little keyhole incisions. And so from a trainee perspective, it can be very difficult to actually see what the surgeon is doing. With surgical robotics, you're kind of both always seeing what's going on at all times. As you can see, there's two consoles. You have the surgeon and the trainee both sitting at the same time. And so it offers this whole new level of dialogue between the two.
If I need to give instructions to anybody, when I'm fully engaged, the microphone picks up really distinctly, and so I'm carrying my voice over to my assistant who's on the other console, and I might say, hey, I'm gonna give you the left arm so that you can do this part of the surgery, but I'm gonna keep the right arm. Or I can tell the person who's bedsiding, hey, go ahead and get those clips ready, we're gonna move on to the next step. And so it gives me the control to talk to the whole room, even though my whole body is engaged inside the console. But because we can do this with such precision, we're able to do these surgeries down into infancy now.
The Vinci 5 will allow us to be able to take care of even the tiniest of children. So babies up to 4 months or even 6 months of age, which has not been able to be done before. They have smaller incisions, they have less pain, and they get to get home and they get to play with their cats and their dogs and their siblings much quicker.
Here at Stanford Children's Health, we are on the forefront of minimally invasive pediatric surgery, and we're setting the standard for surgical care for children worldwide.